Good evening, everyone. Thank you for your time to joining us tonight. And on behalf of ECA College of Health Sciences, I extend a warm welcome to all of you. I will be your host for our webinar. My name is Stephanie, student recruitment consultant for ECA Online Higher Education. And I've been in the education industry for the past 4 years and with the ECA for the past 12 months, helping students achieve their goals and aspirations. So tonight we will discuss the courses that we offer and its career opportunities waiting for our inspiring students. And throughout this webinar, we will go through into the details of the Master of Health Management course, discussing the course structure, and of course, insights from our dean. Deputy Dean. Also, we will discuss the scholarship and promotions that we have, as well as the admission requirements. We have also invited one of our students from the previous intake to share her educational journey to us. So to start, let me give you a brief background as well of ECA College Health Sciences. So ECA College of Health Sciences is a private higher education provider delivering high quality education programs that prepare students for enhanced professional practice and leadership in their field while engendering lifelong learning and strong ethics. So before I introduce our speaker tonight, let me also introduce our dean first. It is my honor to introduce our academic dean, Associate Professor Michelle Cavallari, is the dean academic at ECA Higher Education. With the expertise in course design, student support, and staff development, Associate Professor Cavallari works with faculty to enhance the student experience and improve learning outcomes. Associate Professor Cavallari has a background in languages, linguistics, and TESOL, and she has taught in undergraduate and postgraduate courses and work in specialist academic support roles. Associate Professor Cavallari's teaching experience ignited her interest in feedback and academic writing development, which led her to her PhD research examining technology mediated feedback. Associate Professor Cavallari has presented her research at national and international conferences and is regularly invited to facilitate faculty development sessions at higher education institutions.
Hello, I'm Associate Professor Michelle Cavallari, the Academic Dean of ECA Higher Education, which includes the ECA College of Health Sciences, or CHS as we usually call it. I'm sorry I can't join you live during the webinar today, but I've recorded this short video to introduce myself and talk a little bit about the college. I'm very proud of the ECA College of Health Sciences and our health management programs. I personally don't have a background in health. My qualifications and expertise is in education and curriculum design and pedagogy. So I look at our courses from that lens. And from my perspective, our health management programs are extremely robust in terms of their quality and relevancy and currency. As I prepared this video and was thinking about what to say, there were three things that really stood out to me that I wanted to convey about our courses at CHS. The first is that the content and the curriculum of the course itself is incredible. The units and the topics are varied and extremely relevant to give our graduates a very valuable qualification in health management and an excellent understanding of the Australian healthcare system. The course and the units have been developed in consultation with industry experts in different parts of the health sector through our course advisory committee. The course allows students to bring their prior experience and knowledge into the classroom and then build on that to extend their knowledge and deepen their understanding in the different areas of health management, and then apply that in their career in health in the future. And we know that working in health is very complex and challenging, and our program will equip you to work effectively and confidently in the industry. The second thing I want to convey about our program at CHS is the incredible educational resources and academic support services that you will have available to you. For example, all of your prescribed texts and recommended readings are freely available to you. You don't have to pay anything extra. They're all available online via our library, so you can access them 24/7 off campus at any time. We have a really wonderful learning management system called Canvas, where you'll find a dedicated site for each of your units where you can access high quality content that our lecturers have developed. You can access your readings and other resources and complete engaging activities to facilitate your learning. This is also where you can communicate with your lecturers and your fellow students in between classes. We also have a library and learning support website filled with excellent support resources about different assessment types you'll encounter, referencing, how to access our library catalogue, subject guides for specific subjects where you could access a list of resources that you may wish to use for your assessment. And you'll also find information there about our academic support events that we offer, where you can connect with our library and learning support teams and ask any questions. Our librarians and our learning support advisors are here to help you with your academic journey alongside your lecturers and your course coordinators, of course. For example, they often work with lecturers to provide tailored in-class support sessions to help you prepare for a particular assessment task. So for example, they might run a short workshop showing you how to find resources in the library for a particular assessment task or for a particular topic. Or they might show you an example of an assessment type that you will need to produce, and they'll talk through what it looks like and how to prepare it. You can also book individual appointments for one-on-one support with, for example, again, finding resources for an assessment or understanding an assessment task, or for help writing academically, or for understanding how to reference correctly. All of those skills that often take us a little bit of time to learn. Our librarians and learning advisors are an incredible team, and that one-on-one support from them and that individualized attention and support is something that you don't often get in larger institutions. So we're very lucky to have that available for our students at CHS. And the third and final key aspect of CHS that I want to convey to you is our incredible academic team. Our lecturers are extremely highly qualified, and most of them hold a PhD. And they're also very experienced in the healthcare field. Some of them are medical doctors or other types of medical professionals, and most of them are actively engaged in research in the discipline in the various areas of healthcare. They bring that experience and knowledge into the classroom so you can learn firsthand from these professionals and these academics, which is exactly what you want when you undertake a course like this. You want that connection and guidance from somebody in the field that's very experienced and very highly qualified. And that's exactly the kind of staff that we have here at CHS. So my colleagues will no doubt talk to you more about the specifics of the course and the support and the staff, but I hope that's given you a good overview about what you can expect at CHS, and I really hope you join us, and I look forward to meeting you one day.
And now it is a great privilege to have our Deputy Dean as our speaker tonight to give us a better understanding of the health management courses and its career pathways. It is my honor to introduce him. Professor Gary Day is a senior executive with over 35 years of experience as a health executive consultant, project manager, director, and chief executive officer, as well as a clinical academic and author. Gary has worked in both the for profit and non for profit healthcare sectors across three Australian states, as well as the higher education sector, including project lead roles in major infrastructures and change management, and organization wide roles in workforce development, clinical governance and safety, and medical education. He also co authored the text Healthcare in Arabian Gulf and Greater Middle East, a guide for healthcare professions, as well as completing work on the second edition of Leading and Managing Health Services, an Australasian Perspective. Professor Gariday is currently the Deputy Dean Programs at ECA Higher Education and teaches into the Masters of Health Management program at the ECA College of Health and Sciences. Please help me welcome Professor Gary Day.
Thank you, Stephanie. And I'll just get you to just put the cameras on and just turn off the screen for a moment. Welcome, everybody, this evening, and thank you for making yourself available for this presentation. I'd like to cover just three things with you at the moment, and then we'll talk about the course structure and get your questions and so on, because I know you're very keen to understand more about the program. And I think the three things I'd like to convey to you is, I guess, a bit about my history, why health management, and why ECA. And I guess it's been a part of a lifelong journey for me in healthcare. I actually started when I left school a short time in the banking and finance sector and didn't really find that particularly enjoyable. It was very transactional. And then I found my way into healthcare. And my background is as a registered nurse and midwife quite some time ago. But I started off as a clinician and I worked as a clinician for a while. And then I had a real interest in managing people and managing services. And so that led me on a journey of both practice and education. As I said, I'm a registered nurse and midwife. I've got a diploma in nursing management, a post-registration Bachelor of Nursing, a Masters of Health Management, and also a doctorate in health service management. And I guess when I look at my career, I've moved in and out of both academia, but also healthcare roles. So over my professional career, I've been a middle manager in a large hospital. I've been a senior manager, an executive across a number of hospitals. I've been a hospital CEO and a director of clinical services. I've been a project manager in building a new community-based private hospital. I've done consultancies across Australia and also into China, Vietnam, Saudi Arabia, and the UAE. And I've also worked as a senior director in the Department of Health as well as the Department of Education and Child Development. So I guess my health management background, and most of you are clinicians as well, so having a clinical background and a health management degree, it gives you so many opportunities. And for me, it allowed me to work in a number of different settings across Australia and internationally. My last job, major role before taking on this job, I was 4 years in the Middle East, and I started off as the director for clinical training, education, and research. And then about halfway through my time there, I also added the chief quality officer role as well. So I was the chief quality officer for a major medical city in the UAE. And again, that was due in part or large part to having a strong understanding of health management, my health management master's degree, and my clinical background. And I think when I think about where I've come from and where I am now, that the real benefit of having that understanding about health management, because being a health manager, I can safely say, is one of the most challenging but rewarding jobs that you can have. That no 2 days are exactly the same as a senior or as an executive health manager or even as a middle manager, because you're dealing with people, you're dealing with patients. And our roles are to bring them together in terms of running a great team to make sure our patients are safe and get great patient care. So I really would commend to you, a master's degree or a qualification in health management if you want to be able to have an active role in the health system. I think the other thing about why a health management degree is that it really gives you flexibility and flexibility in terms of types of jobs, flexibility in terms of where you work. I mean, my degree has taken me all around the world working and speaking at conferences and developing other staff. It's also gives you great role variability. So when you do your clinical degree, whether you're a nurse or a dentist or or maybe a medical doctor, you kind of know what you're going to be doing. When you do a health management degree, that gives you the added bonus of being able to work in anything from a project role through to a departmental or a divisional role or a CEO eventually as you gain more experience. So you're limited only by your own ability about where you want to go and where you want to work throughout the world, and where you would like to actually practice and go. And I think that's the great thing about having a health management degree. And I guess that takes me on to my third point about why ECA. And I know Michelle talked a little bit about that before, but I've worked in 3 Australian universities. I've also taught in Hong Kong, Singapore, the UAE, and into the UK. And so I've got a lot of experience in health management education right across the globe. And I think what really impresses me about ECA as an organisation is it's just got such a great faculty of international and experienced academics who come from all around the globe, and they bring their expertise into the teaching that you will get at ECA. I guess it's also a great learning atmosphere, and because our classes are not huge, you get a lot of contact time with your academic. You're able to ask questions, and there's also great support for students with our learning support officers who can help with things like referencing, how to answer an assignment, for example, and so on. And I think the other thing that ECA is, and I'm actually driving this for ECA, is a lot more industry engagement. So having industry and academia working more closely together, so that for you as students, you're going to get the best of both worlds. You're going to get the theory of health management, but it's going to be intertwined with what's happening in industry, the industry-based projects and seminars from people who are working in hospitals, in healthcare somewhere. And I guess having worked in at least 3 Australian universities in health management, I think the ECA program is as good or better than what you would get in a university setting, but in a much more comfortable and smaller environment, which allows for greater learning. So they're really the things I wanted to cover with you about why health management, why ECA, and just give you a little bit of an insight into my journey and where health management has taken me, over the last 35 or 40 years. And, it's culminated also in a couple of books that hopefully will help students and healthcare people into the future. So thank you for your time. I think we'll move now into having a look at some of the course structure. And then we'll move into some of the questions as well. So within health management at ECA, we have what we call nested programs. So we have a graduate certificate in health management, which is 3 units, which we run. We run them 3 times a year. So we run a trimester series, but there'd be 26 weeks involved in you finishing 3 units online. If you're enjoying the graduate certificate, you can then move into the graduate diploma, which is 6 units, which is double the size of the graduate certificate, and that's over a 1-year period. So three trimesters. So you do, 2 units per trimester, so you would have that finished in 12 months. And if you want to do the masters, that's 12, equivalent of 12 units in total. It's actually 11 units, but 1 unit is a double unit, and that will take you 2 years doing two units a trimester. So that's the progression across the 3 different degrees within health management. And if we go to the next slide, we'll give you a bit of an idea about the type of content. So we quite often start with the Australian healthcare system, which really looks at how the Australian healthcare system is constructed and how it operates. But we also do comparisons with other international healthcare systems so that you can get a comparison and contrast in maybe your own country's health system as opposed to Australia. The next two units are ones I really love. Clinical governance, safety and quality, such an important thing for clinicians to understand how we keep our environments safe for the patients that we look after. How do we set up systems and frameworks to ensure that our patients get good, quality, safe care? The subject that I teach, leadership and management, is really about developing yourself as much as anybody else. We then go into evidence-based practice. We have an information management technology and healthcare unit. Then leadership and collaborative practice. This is around working within teams and understanding more about leadership. Then change management, strategic planning and organisational planning, health finance and economics, health statistics and epidemiology and critical analysis. That's really important for understanding data. And then you finish off with a double unit, which is a capstone unit or a research project. So there's a total, there's your whole master's degree right there, in total. So 12, equivalent of 12 units and 1,728 study hours. So there's the broad overview. Now, if we move on to the next slide, I think that's probably the end of where I'm talking now, but I can take your questions at the end. You want me to talk on this one, Stephanie?
Yes, please.
Yeah, and look, I'm not going to spend a lot of time on this because you could read that there, and I have covered some of this, but it really, your health management qualification will actually help you as a person as much as it will in developing skills and perspectives and abilities to manage quite complex environments and systems and departments that you might end up working in. You'll get an understanding of advanced skills in, evidence-based practice, information and technology management, strategic and workforce planning, health finance, and so on. And I think when you complete a health management qualification, it will lead you, as I said before, to a range of public or private operators, government agencies, things like the World Health Organization, clinics and community health services, and a really growing area in Australia and overseas is quality aged care services. So there is no shortage of places where you can combine your clinical background with a health management qualification to get you into a management role.
I know that students would love to know as well the fees and charges. So ECA, College of Health Sciences, is committed to providing cost-effective and affordable learning and development opportunities for students. Now, our fees are amongst the lowest in the higher education sector, inspired of the high quality of education delivered. So for our Masters of Health Management, total of 12 subjects, that's $31,200. And for our graduate diploma, that's total of 6 subjects for $16,600. And for our graduate certificate, a total of 3 subjects for $7,800. Now, we don't charge per course, we charge per subject, as you will be enrolled per subject. Now, per subject is 2,600. And if you are eligible for the scholarship, yes, you may apply, but at the moment, it's only for the Masters of Health Management students. So that brings you down to 1,900. For the 12 subjects, a total of 22,800. So don't worry, we'll dig deep into the scholarship later. And now, so I'll just go ahead and do the scholarship. So ECA College of Health and Science is offering limited scholarship for our eligible domestic students. And I'm excited to introduce you the Dean Scholarship at ECA College Health of Sciences, specifically designed for our Master of Health Management programs. This is more than just financial support, as it is a gateway to unlocking new possibilities in your career. Now, here's the thing: these scholarships are limited and highly competitive, so only a select few will be awarded. But if you're passionate about making a difference in the health sector and you have the drive to succeed, this could be your chance. So let's talk about it, how you can be qualified. So to meet the entry requirements, first you need to submit all your documents, okay, to ensure that you are ready to take the challenges of advanced health management studies. And finally, we want to hear from you. So, in a brief statement, share with us how studying management, Master of Health Management, will positively impact your career in the health sector. What drives you, and how do you envision making a difference? If you meet these criteria, you could be the few to receive scholarship. So don't wait. The opportunity is here now, but it won't last forever, as the saying goes. So share your vision and take the next step towards a brighter future with the health management program. And of course, ECA College of Health Sciences is a registered fee help provider. Now, Australian citizens have the option to apply for a government loan to cover their tuition fees. So here's how it operates. During the application process, you'll complete an electronic Commonwealth Assistant form, or what we call ECAF, to apply for the government loan. Now, typically, repayments are income based and commences when your salary exceeds the fee help income threshold. Fee help is applied when you enroll in a subject. So, for example, the Master of Health Management, there are 12 subjects to complete, right? So each time you register to enroll to commence a subject, the subject fee is 1,900 for those who are scholarship recipients and 2,600 for non-scholarship holders. Now that will be applied to your fee help loan. Students also have the option to choose to enroll in additional subjects, such as the second or second and third subjects, depending on your preferred pace. For more information, you may visit their website at studyassist.gov.au. I have flashed it on the screen. Now, of course, students who enroll for our upcoming intake will receive a 12-month complimentary subscriptions to ECA Online Skill Builder short courses and Employability Advantage. Now, please take note, this is just a limited time offer. Okay, so this is for the September intake promotion. And ECA Online Skill Builder short courses are a great way to enhance soft skills needed in a professional environment. Complete short courses in leadership, interpersonal skills, and creative problem solving. We also have Employability Advantage, which offers essential tools and resources to help our students launch their career and gain the confidence and skills needed to succeed in the professional world. All right. So for our intake date, this is the last intake for this year. Trimester 3 will be on September 30th, and application cutoff date is on 27th of September. So let's just walk through briefly the admission requirements. So for our Masters of Health, okay, admission to the Master of Health Management is based on the following requirements. It's either you have bachelor's degree equivalent to AQF7 or higher qualification in health-related discipline. Of course, if you have successfully completed the graduate diploma or graduate certificate in health management. Now, alternatively, students who do not meet the entry requirements for the master's may also use the successful completion. If they have minimum 3 years of relevant working experience in the related field. For our graduate diploma, again, if you have bachelor's degree equivalent to AQF7, or if you have minimum 2 years of relevant working experience in the related field. With our graduate certificate, is the same with a graduate diploma, which is if you have bachelor's degree equivalent to AQF7, or if you have minimum at least 2 years of working experience. And as mentioned earlier, I have invited one of our students from July intake to share us her educational journey with ECA, College of Health Management, Health Sciences. She is currently taking Masters of Health Management. Please help me welcome Anita Swan. Hi, Anita.
Just turn on your microphone, Anita.
Yep. I have enabled your camera and microphone, so you may start.
Okay, you can, okay. Yeah,
Hi
sure. So,
there.
hi, you can see me. Okay, so as Stephanie said, I started in the July intake. I'm now 11 weeks in and absolutely loving the course. Um, the content of the online systems and the course is excellent. Every week there's a fresh module, and in the module there's a video, then there's a PowerPoint, and then there's a self quiz that you can test yourself. It's not marked, it's just so that you can see how you're tracking. And then there is a workshop discussion every week. So if there's something that I've missed in the video or the PowerPoint, it then comes up in the workshop discussion, and I really value that. I'm finding I'm learning quite effectively. A lot of the content is really practical. I'm seeing and learning things that I'm already implementing at work. And so I'm seeing that relevance, and that's helping to inspire me to enjoy the course. The assessment is very supported. So there's 2 to 3 assignments per subject, and not pressurized exams. So there's no, assessing just the short-term memory. The assignments really give you a chance to apply what you've learnt in the modules, which is very practical. They're all scenario-based case studies, and they've been great. The professors incredibly helpful, very accessible. I had a question on my last assignment, and the professor got back to me within the same day, and I was able to move on and solve what I needed to in order to submit the assignment. So that's been really appreciated, and they're very knowledgeable. Their experience is deep, both clinical and in management. And you're not a number. They know who you are. They know your background. They know the things that I'm gonna grasp quickly because of my background, and the things that I don't have. So I don't have hospital experience. So the professors always kind of guide me and help me with the areas that I don't, so that I'm growing and I'm learning. And we also learn from others in the group because there is shared backgrounds, across aged care, across hospitals, across rehabilitation. So it's quite diverse. So they help facilitate that. And yeah, as I said, I'm really enjoying the course, and look forward to doing more.
Thank you thank you so much, Anita.
You're welcome.
Thank you for sharing. All right, that's it. Thank you so much for attending tonight. We would like to thank as well our speaker, Professor Gary. Thank you so much for attending here tonight.
My pleasure.
Thank you.